Great.
Thank you for the kind words, Larry. Get my slides up. Not too many. I have to say that this lecture is something I've worked on for a while, and it has a couple of different phases. So I've got a section of kind of reflections because it's giving me a chance to look back for the last, January I'll be here 32 years. To give me a chance to look back at everything I've done during that time, interactions with students, precepting. So I have some words on that. But then I really wanted it to be past, present, and future for Temple, for the pharmacy school. So I really like history, so you'll have to bear with me. I've got some, in my mind, exciting things to show you. Old pictures of the school, when the school was not on this campus, historical things, what was here before the school was here, things like that. Hopefully you'll find that to be interesting. I find it really interesting. If not, bear with me. But yeah, that'll be the past. Talk a little bit about pharmacy in general in the present, and then a little bit of kind of where we need to go as a profession. So one of the things I did this weekend, some of you know my son, because he did work here as a student worker for a little while. And he was over for dinner this last weekend. And I said, yeah, I'm doing the award. He had to work today, so he couldn't come. And I said, yeah, that's going to be called TUSP at 125, past, present, and future. And he says to me, oh, just like a Christmas story. Right? Like, that was not what I was going for. I thought that's my son. So we can get started here a little bit with kind of the reflection. So I'm used to lecturing. I'm used to lecturing in class and not like reading things and stuff like that. But as I wrote this and as I did, I really want to say it the way I wrote it. So I'm going to kind of refer to my notes and kind of, I'm not reading to you, but I really want to say some things about, what the school means, what the profession of pharmacy means to me. And I hope you'll enjoy it. So at least initially, good afternoon, right? I can't believe the turnout. This is great. I've been to a lot of Sprowls lectures before. I want to thank the students and everyone else, staff, faculty that have come today. I don't know what threats were put out there here, but I appreciate it. And, I'm deeply honored to get this award this year and to be recognized for me from my alma mater and by the community of professionals who shaped me. This is profoundly humbling to me. When I received the news, my first thought was, surely there must be other alums more deserving than I. But the more I reflected, the more I realized that this recognition is not just about my own journey. It's about the countless mentors, colleagues, patients, students, and family members who shaped this journey. So I accept this honor today with gratitude and also with a sense of responsibility to give back to the school as generously as I have received. I do want to thank a few people initially before I get started. First, I want to thank the Alumni Association who's presenting the award, for selecting me for the award and the wonderful work they do. The Alumni Association supports many events here at the school. They support many students in a lot of different capacities. Sometimes these interventions do not go, fully recognized, but we want to make sure that they know that everything they do for the school here is very, very appreciated, whether it's on the student services side, or events, or mentor night, or whatever it might be. Next, and most importantly, I want to thank my wife, Deborah, who's sitting right here. Without your support and love throughout all these years, nothing would be possible. I'm a better person because of you. You keep me grounded. You make me realize the important things in life, like family time, creating indelible memories from all our time together. Thank you, dear. Yeah. My best friend, and I have to say, brother, Dr. Carey, Larry Carey. We did start together in that first PharmD class back in, I'll say it, 1990. Well, we were like, we weren't even born yet. We did start with 12 students. He did tell you that 7 graduated, but he did leave out that 2 left on the first day. So we had 10 after day 1. They were like, I'm bailing on this. I can't do this. So it was a lot of fun. But the one thing I do want to say to you, and we've talked a lot over the years, you've been the yin to my yang, wonderful sounding board, collaborator over the years, and you help me see things I may not realize on my own. Thank you for all your help and support. Overall, my colleagues here at Temple, without your collaborative efforts, we'd never have been able to accomplish the things that we have up to this point and the plans that we're working on for the future. So I want to acknowledge your, collaborative efforts, and I do appreciate that. My mentors at Temple and outside the walls of this building are too numerous to mention individually, but I've learned invaluable lessons from each of you. So there's plenty of mentors, you guys, I'm sure, students sitting here, you'll have plenty of mentors during your career. These are people you should value. All right, so reflecting on the journey a little bit now. When I first walked into this building in 1984, that's when I started to get my first degree. I never imagined where the path of pharmacy would lead me. I had a vague idea of what pharmacy was about, something to do with medications, science, healthcare, but I didn't quite understand the depth of responsibility that a pharmacist has. What began as a desire to serve patients has evolved into a lifelong mission of advancing health, expanding access, and elevating the role of pharmacists in our healthcare system. Along the way, I've been guided by the lessons I learned here, the importance of integrity, the importance of collaboration, the belief that every patient interaction is an opportunity to make a difference. So in my personal journey, right, I started working at Methodist Hospital down in South Philly the June before I started pharmacy school. So when I started, I knew nothing. I knew less than nothing. Right? I hadn't dispensed drugs. I hadn't touched drugs. I didn't know generics. I didn't know brands. Right? So I started from below ground zero. I stayed there for 3 years. And during that time, then I also worked in a small pharmacy down in South Philadelphia on kind of a couple evenings a week to kind of see the community side of it. But then eventually I graduated. I graduated with a BS in pharmacy. That was the degree that everyone got at that time. And when I graduated, you're going to hear some names of some companies that don't exist anymore. I started working for Thrift Drug. Heard of Thrift Drug? Yeah, I see the old heads. Yes. I have no idea what you're talking about. Thrift Drug. So I started working at Thrift Drug as a graduate intern in Jersey. Then an offer came in to work in South Philly for a Thrift Drug. So I was working at 24th and Oregon. And I just have to tell you a really quick story about it. The store that I was the manager of was underneath a bowling alley. All right, so the bowling alley's on the second floor. So just imagine that, that was the first place I ever worked on my own. I was the pharmacist in charge. But you'd work a 12-hour shift, and about 5 o'clock when it was league night, all you heard above you were the balls going down, and then you hear the pins crash and whatever. So that didn't last too long. I left there after about 3 months. And then I worked for Rite Aid. I managed a store at Broad Snyder for about 4 years. One of our alums who just got an award as Preceptor of the Year, Basil Hamid, he managed that store until it closed just recently. So it was kind of a neat store. So then after doing that for a while, I said I wanted a little more. So I wanted to come back to school. So I came back applied to that PharmD program here at Temple. I heard that they were going to create the post-BS PharmD. And then what I did was I kind of like cobbled together a bunch of jobs. I continued working at Rite Aid for a little bit, and then I resigned. But I worked at a small hospital down in South Jersey for about 13 years, actually, even when I was working here as a faculty member. I worked at Jefferson Hospital nights and weekends. I worked as a consultant to Rhone Poulenc, which is a drug company that doesn't exist in that form anymore. I worked in medical affairs with them. So it was a way to work multiple jobs and pay tuition. So it was able to be done. Easier for me than it is for a student nowadays. You guys are getting paid intern salary. I was already a registered pharmacist. So I was able to work and pay for my education, which worked out really well. Graduated from the PharmD program and then did a fellowship across the street in drug information and pharmacoeconomics. But then I did a bunch of stuff here. My original position across the street, director of the Drug Information Center, was a shared position between there and here. So I was paid 50% from the school, 50% from the hospital. And I lasted there about 5 years. But me personally, it kind of became untenable because 50-50 shortly became 100-100 in terms of expectations, and it was just really hard to meet both. So I was either going to move on, but the school decided to absorb me 100%, so I stayed. So after I left that Drug Information Center position, I started to work in managed care and ambulatory care down at Broad and Lehigh. There was a clinic down there. It was a wonderful physician that I worked with that took med students and podiatry students. I had pharmacy students. It was a great clinic environment. But after about 2 years, that person left and went to Reading. The new director didn't want to do anything with students, so I ended up leaving that site. And I went to MCP. Now you're going to start hearing places that don't exist anymore. MCP, that I had an ambulatory clinic over there. I was there for a few years, closed. I'm starting to think it's me now. After I left there, I went to Northeastern Hospital, which was part of the Temple system, which is down on Allegheny Avenue. Now it's an ambulatory center. But it was an inpatient. I was doing internal medicine. And I was there a few years, and guess what happened? It closed. All right. So I said, luckily, two of the folks who were there, the director and the assistant director, both went to Pennsylvania Hospital. And they said, hey, do you want to follow us there? And I figured I was pretty safe, right? It's the oldest hospital in the country. They're not going to close that one, right? So I've been there since then. So that's kind of been my, precepting clinical practice kind of experience. I've done some ambulatory, I've done some inpatient, but most recently inpatient. So the three lessons that I like to impart for students, moving forward. Pharmacy is about people, not pills. Sounds very simple, right? Behind every prescription is a story. You just don't dispense medication. We dispense hope. We dispense reassurance, and sometimes even courage. Whether it's the patient with a new cancer diagnosis, the parent holding an antibiotic for child, or the elderly patient juggling 5 chronic medications and conditions. Our role is to see the human being first, right? This is something I always do. Now, with the students in the room, you're already going to know this story, right? Every year when I start teaching the drug information course at the beginning of the fall semester, usually the first class, always the first class, you guys are all nervous sitting there, and I'll ask you a question. What's the dose of Tylenol? All of you are like, hey, I know that. I know an answer. And you all raise your hand and start answering. 500 milligrams, 975, 1,000 milligrams, 325. And I listen to all the answers, right? And you guys are all proud of yourselves, and I tell you you're all wrong. And they're like, why? I'm like, well, think about it. You don't even know who the patient is, right? Maybe it was an infant. That dose you just gave is lethal, right? Maybe you didn't check any drug interactions. Maybe you didn't tell me an interval. If I just said 500 milligrams, how often? What, every hour? Or until I feel better? No, that's not right. So starting from the very beginning to kind of get students to realize that there's a patient behind that, not just a prescription. And when you realize that, you'll take the appropriate care. Another one is our ability to be adaptable. So adaptability is our superpower as pharmacists, right? Over the years, our profession has had enormous changes, right? New therapies, new technology, shifting policies. Most recently, right? Not too far in the rearview mirror, COVID. What happened during COVID? In that moment, pharmacists stepped forward as vaccinators. Dr. Wachowski, Dr. Carey ran injection clinics all over the city. Other faculty joined in as well. I don't want to leave anyone else out. Students got the ability to be able to vaccinate. So we stepped up, filled a need when there was a need to be filled, and it was a major public health victory for pharmacy, right? But we are vital, adaptable, and indispensable in that particular area. And our legacy is built on giving back. That's our third tenet, right? The achievement, impact of monitoring a student or mentoring a student. That's one of the biggest things, the giving back. That's the giving back that I get to do, to mentor a student, serving the community, advocating for the profession. Each time we lift someone else up, we strengthen the entire field. For me, some of my proudest moments have been personal accomplishments, have not been personal accomplishments, but watching a former student grow into a confident, compassionate pharmacist. It really is the best feeling. So, a couple of other things. The three major areas that I've really experienced that I want to expand on a little bit, are academia and student services, and I'll have a third one for you. But in academia, what did a career in academia look like, right? Was not my direction initially, right? I was going to go into the pharmaceutical industry, right? Had offers, did things, decided to do a fellowship instead, ended up staying, right? And I do like to teach. Standing up here was not something that I ever thought I could do, right? Most people would rather jump out that window than do public speaking, right? But it's not that bad. It really isn't. So looking back on my career in academia, I want to trace a path shaped by science, education, the privilege of developing the next generation of pharmacists. It's a journey that begins with curiosity about meds, about mechanisms of action, and the profound impact they can have on human lives, and evolves into something even more meaningful, a lifelong commitment to learning and helping others learn. Academic pharmacy is a career rarely defined by a single accomplishment. Instead, it's built in layers. All the faculty in the room know this. Semesters taught, cohorts mentored, research questions pursued, countless office hour conversations, accreditation deadlines, new curricula built, and partnerships formed with colleagues who share the same mission. Over time, one realizes that the most important outcomes are not always published papers or program innovations, but the student who goes to become a compassionate, competent professional. Many of them who change lives in ways that we never fully ever hear about. There's pride in the science. Of course, in staying current with an evolving field, asking better questions, contributing knowledge, and shaping practice. But there's also pride in seeing pharmacy education itself transform, embracing evidence-based instruction, interprofessional care and study, new clinical technologies, and broader understanding of what it means to serve patient communities. A career in academic pharmacy is also a journey of mentorship. Many of the most rewarding moments come not in the classroom, but afterwards, when former students return to share their success, their challenges, and their realization that learning truly continues well beyond graduation. And from my point of view, they come back or email and say, hey, I really did need that biostats. I didn't have any idea why I was taking that course, but I needed to use it. Knowing you played a part in a student's professional identity is one of the greatest honors. And finally, there's a sense of legacy. Not legacy in a sense of personal recognition, but legacy through impact on students, on the program, on the profession, and on patients whose lives were improved because a student learned something they needed to know on your watch. Looking back, academic pharmacy is a career defined by service. I wouldn't have done anything else. To education, to research, to colleagues, to students, and ultimately the health of communities. It's a career built on knowledge, but sustained by purpose, and one that leaves the educator with just as much learning as those they taught, right? You learn something better when you teach it. So supporting students, something that a little further into my career I ended up becoming involved with is with student services. So, and I realized that how multifunctional it is and how many responsibilities you have. So supporting students here at the school means recognizing that each student's journey to becoming a pharmacist is both intellectually demanding, you guys all know that, a lot of study, and deeply personal. Every student arrives with a different story, a different learning style, and a different set of strengths. And meeting them where they are is one of the most important responsibilities of pharmacy educators and mentors. It begins with creating an environment where students feel seen, feel valued, and safe to ask a question. In pharmacy, questions just aren't academic. They're essential to patient care, clinical decision-making, and lifelong learning. Encouraging curiosity, transparency, and dialogue helps students understand that uncertainty is not a weakness, but rather the beginning of critical thinking. All the students in the room, when you get to your 4th year, unless you're already there, probably one of the first things your preceptor will tell you, if you're asked a question on rounds, it's okay to say, I don't know. Perfectly fine, right? I don't know. I'll go back. I'll research it. I'll get back to you. That's okay, right? So uncertainty isn't a weakness there. You're going to learn that. Next time you get that question, you're going to know the answer. But that happens all the time. Support also means teaching students to grow in confidence. Pharmacy education is rigorous. Students face high expectations. You guys know that from preceptors, faculty, and the expectations you have for yourself. Offering constructive feedback, helping them learn resilience, and reminding them that improvement comes with practice can make the difference between self-doubt and self-belief. That's definitely what happens. Student services. Now, Haley's not here today. She's boycotting my talk. No, I'm just kidding. She's down at main campus. She's doing a leadership seminar, and there's a few other folks that are in that leadership seminar as well. But she really is the face of what students see when you need help, right? Where do you go first? Find Haley and go from there. So support means pushing students forward, challenging them, thinking critically, seek leadership opportunities, all the things we try to push you to do. Embrace evidence-based practice and see yourself as future contributors to the profession. When we provide structure, expectations, and trust, we give students room not only to succeed, but to strive. And finally, supporting pharmacy students is understanding that the goal is not just to prepare for exams, but to prepare for your patients, right? You're going to need to pass those exams, but that data has to stay resident so that you can use it and apply it. And I'll talk about that next when I talk about precepting. Patients who will rely on you to make sound decisions in some of life's most important moments for them. In the end, supporting pharmacy students is an investment in the future of healthcare. Every encouraging conversation, every breakthrough in understanding, every professional milestone reached becomes part of a much larger impact. Better pharmacists, stronger communities, and improved patient care for years to come. Now, the third phase of something I wanted to speak about is kind of clinically precepting students and what that's about. Precepting clinical pharmacy students is one of the most direct and meaningful things that I do and shapes the future of the profession. I can't remember how many students I've precepted over the years. Larry said thousands. I don't know. I can't imagine that that's that many, but it's a lot. It brings together some interesting things. Teaching, mentorship, because you begin to develop a different relationship with the students that you're precepting. It becomes more collegial, right? It's no longer you're in front of the classroom speaking to a bunch of students, and it's that faculty to student relationship. It's now collegial. You're responsible for some of the same things I'm responsible for with regard to the medical team. So in doing this, right, it brings together teaching, mentorship, and patient care in real time. So we've always said when APPEs start, that's when it all comes together. What you know and how you apply it. Student learning and patient outcomes also intersect. So clinical rotations are a pivotal transition for students. Classroom knowledge becomes actionable. Decisions carry consequences, right? Your preceptor has to approve your decisions. No student is acting autonomously. Professional identity solidifies in this environment. But the way I like to think of it is the preceptor is a guide who models how a clinical pharmacist thinks, communicates, collaborates, and advocates for their patients. Effective precepting begins with creating a supportive learning environment. I know everyone else does something similar, but when I have students on rotation, it's cliche. No question is dumb, and you can ask anything. Because I want you to ask, I want you to make mistakes when we're reviewing patients, not when we're actually on the floor. So you can ask anything. We can discuss anything. And let's clear up whatever misconceptions you might have about, that evidence-based therapy that we're talking about, right? Students have to be comfortable asking questions, sharing their thinking, acknowledging the uncertainty, acknowledging that they don't know. That's okay. We'll fix that. The goal is not to make them experts overnight, but develop their clinical reasoning step by step. This means asking thoughtful questions, challenging assumptions, and encouraging students to explain not just what they're recommending, but why. And if you've ever done a rotation with me, and I don't think anybody in this room has, you get really sick really fast of me asking you why, right? You're going to tell me, oh, let's use this drug. Why? Why? How? How does it work? We got to understand the background, not just the knee-jerk, okay, that's the drug we use. Well, why do we use that drug? Then it makes sense. So feedback is also the other side with regard to precepting. The best feedback blends clarity with encouragement, recognizing the students doing well while helping them see how they can sharpen their judgment, documentation, and communication. Students learn from their own performance, reflect on their progress, this whole metacognition. They can see what they need to work on if you point it out to them. Precepting also means knowing when to step back. So you're not micromanaging. Students not only grow through guidance, but through the responsibility of contributing meaningfully in clinical practice. Letting students speak to providers. Let them counsel patients, right? You're there. You're the safety net. Reviewing their therapy and participating in rounds with your support right behind them. Just as importantly, precepting is an opportunity to teach values of the profession. So it's a chance to talk about ethics. It's a chance to talk about how should we treat this patient? How can we treat this patient? How can we help them? The preceptor's influence travels with those students in the habits they form, the confidence they build, and the care they provide throughout their careers. And while preceptors teach students, students also teach preceptors. They bring new perspectives, questions, they challenge assumptions, and remind us of the excitement we felt entering the profession. That's why I love to do the first rotation. I love being on APPE 1 block. the unbridled enthusiasm of students coming into their first clinical rotation, right? Wanting to learn, right? Later in the year, it kind of dies down a little bit, right? But at the beginning, it's tremendous. And I've always tried to take block one at the beginning because I really, really enjoy that excitement. And it helps renew my commitment. In the end, precepting clinical pharmacy students is more than supervision. It's privilege of shaping how future pharmacists think, practice, and serve their communities. All right. That's enough of me. But that was reflection. I had to look back. January this year, I'll be here 32 years. So I really wanted to kind of sum up kind of what my thoughts have been over time. But since this lecture is in honor of Dean Joseph Sprowls, Jr., figured I had to look up who is he? Who was he? Other than knowing that he was a dean, right? So I've got a slide here just to kind of talk about that quickly. Who was he? Well, he had faculty positions at the University of Buffalo and University of Colorado. He's originally from Colorado. He was dean at Temple from 1950 to 1967, so 17 years. While he was here, he was the executive on the board of AACP, very prestigious. He was on the board of directors of the American Cancer Society, and he edited two widely used textbooks from the time: American Pharmacy, Introduction to Pharmaceutical Techniques and Dosage Forms, and Prescription Pharmacy, Dosage Formulation and Pharmaceutical Adjuncts from the time. He was considered an excellent teacher, capable researcher, and a superior administrator. He did leave Temple in 1967 and went to University of Texas at Austin to be dean there. And 4 years later, he passed away at the age of 58 from stomach cancer. So he did leave an indelible mark here for that 17 years he was here. We'll talk about the past now. This was the fun part to write. All right, everybody's seen that picture probably. If you went over to the hospital, that's Samaritan Hospital. That's what Temple Hospital looked like in 1893. All right, it was basically like a larger building, right? But the reason I mention it is the School of Pharmacy, Nursing, and Medicine all came about when Temple purchased Samaritan Hospital in 1891, right? Initially, at the time, pharmacy was a 2-year program, and we shared classes with the medical school. Now, where did we go to class? Well, we didn't go to class here. You might recognize that building. That's called College Hall, still on main campus. Kind of full circle. We graduate right next to this building. So first classes were held in 1901 in College Hall with the medical school, and classes initially were held at night because people were working. So it needed to be flexible. And you've heard that story before about the night owls down at main campus. Temple only started in 1884, so Temple was in its infancy as well. So this photo of College Hall is from 1900. Let's take a look. So from 1901 to 1907, pharmacy school moved to 18th and Buttonwood Streets. Anybody know where 18th and Buttonwood Streets is? I didn't either. I had to look it up on a map. It's right next to Community College of Philadelphia, right? 18th and Buttonwood Street, where this building was, is now a huge apartment building called North by Northwest. But this picture is from 1907. And when the pharmacy school moved, Dr. John Meinhardt was appointed the first dean, serving until 1932. Now, the thing that's kind of interesting, we moved with dentistry and chiropody, a word you probably don't hear that often, but that's podiatry. In 1925, the degree was a 3-year degree, and in 1932, it became a 4-year degree. So I was able to find these pictures in a variety of different places. I was interested in what the sign said. There you go. Can't read it as well, but I'll tell you what it says. It says the Temple University School of Pharmacy, right at the top. Next, it says down here, Philadelphia Dental College. And here it says the Department of Chiropody. So that's what was in the building. It was a little bit cramped. All right. This is a picture from 1912 of a student in lab and students in lab, elbow to elbow. So 18th and Buttonwood was our location, but that didn't last too long, but it did last until 1947. So what I want to show you is what was going on this campus in the interim, right? Some of you that have been here a while might remember the GSB building that used to be right next door, right? The General Services building. Well, that was originally, this is what it looked like. This is a picture at Broad in Ontario, the Masonic home. It was a retirement home for Masons. So that's what was there till Temple eventually bought it. Now it's a grass lot. Right? There's nothing there right now. But this picture is from 1925. So this was in the interim. That building was there. Now, this one's a little harder to see. So this is actually a land use map from the city of Philadelphia from 1925. You can see here, Masonic home, right? You can see here, North Philadelphia Real Estate Board. This is where we are. Rising Sun, right here, right? You know what was on the corner? A gas station. Right at the corner of here, Rising Sun and Broad on that little, on a little triangle. But some of the other things I noticed in looking at this part of the map, notice across the street, some of you may park in the Battersby parking lot across the street. I know the dean does. It's called Battersby parking lot because it was Battersby Funeral Home in the bed. And the university bought the lot and then turned it into parking. So you can see that Battersby Undertaker and garage. Right? You can see there's a lot of garages on Broad Street here in this area. Notice something else. This is where we eventually moved to before we had our own school. This is the dental school. Notice it was part of the Packard building. Packard Motor Cars, they owned it. Also, the Bendix Aircraft Corporation was there as well. They made most of the parts and things that went into planes during World War II. And then on the corner of Allegheny and Broad here, there was a Ford dealer. So I don't know. I'm always interested in like what came before, then and now. Like what did it look like? What does it look like now? Here's a picture from 1926. Here's the Faculty Student Union building. Still looks the same. Here's that Masonic building here, right? You can see the church. That's Broad and Allegheny, right? And over here are the buildings that made up what was here before it was the pharmacy school. And notice, the more things change, the more they stay the same, right? We never had an island in the middle of Broad Street, but they sure did in 1926. Now we have it again. Right? So that's what it looked like here. So it wasn't finished yet. Now this is a land use map from 1942, and you can kind of see some of the same things. Everything has kind of remained the same. This little S here where the pharmacy school is, that means that it's a service station. The Battersby Funeral Home is still here. Auto showrooms, auto lots, the Masonic home as well. I just thought this one was interesting because right here, if you can't make it out, it says lunch wagon. So I guess the trucks have been here. Some other things about the school. In 1942, during World War II, they came up with an accelerated curriculum to get pharmacists so that they could go and serve. So they adopted an accelerated curriculum. It started in July. It was 4 years, completed in 2 years and 8 months. They just removed all the holidays, and there was no summers. They just went straight through. The same scholastic standards for all the courses were still upheld. And that was still happening at 18th and Buttonwood at the other campus, because we didn't leave there until 1947. I found this picture. This is Broughton, Ontario. All right. This is McDonald's. All right. Here's your Subway. Over here is that Ford dealer that I mentioned, is at Broughton, Ontario. And this is looking eastward on Allegheny Avenue. So that's kind of what it looked like back at that time, at Broughton, Allegheny. But in 1947, we moved from the little Buttonwood campus to the dental pharmacy school at 3223 North Broad, where the dental school is now. You can see it here. Again, it was the Packard building. It was Bendix aircraft. This is what classes looked like in the dental school. A little more elbow room. This is a picture over here. This is 1957. This picture here is 1948. They both happen to be pharmacognosy classes. I don't know why they picked pharmacognosy classes for the photos, but you can see what was going on. So what ended up happening during that time? Dean Sprowls stepped in. Enrollment was going up in the 1960s, right? And the dean was looking to have our own building, if we could get that, right? He was trying to get funding. He could not get funding. I don't know if that's why he left, but that's about the same time. But in 1969, and I thought this was really interesting, the NIH gave a grant for $2.3 million for the school under Dean Alfred Martin. And the Pharmacy and Allied Health building was constructed. It opened in December of 1973, and the first classes were in spring of 1974. This is the only picture I can find of the construction. So the building's already pretty well built. You can see it's still not done yet, but finished work. So this is at some point in 1973 when they're taking that picture. And that's what our home looked like when it opened. Notice, no ramp, right? Looks very different. No ramp, no signage, none of that other stuff, but this is what it looked like way back when in 1974. There's a couple other things here. Present pharmacy, I just took a picture of the lobby. These are some challenges, right? Working conditions in the community setting, pharmacy deserts. You hear a lot about that now. You heard about food deserts, now you hear about pharmacy deserts with stores closing. Chain pharmacies closing related to the pharmacy deserts. Reimbursement issues, major issues, right? PBMs. Navigating digital transformation in terms of how we're communicating and handling patient data and things like that. Managing the increased workload and pressure. COVID was probably one of the biggest problems that we had. There was a lot of negative influence, I guess, from the pharmacists that were practicing at the time, especially in the community setting, because they were overworked and expected to do a lot. And it seems like a lot of students were then scared off to kind of come into pharmacy, but we're starting to recover, right? And then other things we need to do, continue ensuring med safety and meeting patients' expectations for personalized care. So in future directions, we have a bunch. AIML, but AIML, when you talk about AI and machine learning, right? I put this here very specifically, as a partner in practice, helping you to practice better, doing things to give you the information you need to make your decisions. Also in research, and then also incorporating AI into education. Other things, adaptive learning technologies, curricular innovation. We're in the midst of a curricular revision. We have significant competency-based education, but there's probably more on the horizon. Other things, pathways for students, certificates, minors, dual degrees, other ways to specialize. Pharmacy is such a varied profession. There's so many areas where you can practice. And also expanded legislation to let pharmacists be able to practice at the top of their license, to be able to do what they need to do to take patients' health and improve it. So some of the other things, reforming or eliminating PBMs. I don't know if the eliminating will ever happen, but PBMs are an issue. Reimbursement issues go right along with it. Provider status, expanding. We do have some provider status, but expanding it to be able to do more things. Expanding 340B pricing, so more patients have access to drugs that potentially can't afford them. And then expanding reimbursement, and then telepharmacy is something you're starting to hear a little bit about now. Like if you work for Amazon or something like that, you may need that. Okay, I just have a very short closing statement. Just in closing, pharmacy is rapidly changing. We're on the front lines of some of the most pressing challenges in healthcare, ensuring safe med use, addressing health disparities, embracing innovation, and advocating for our profession's rightful place as providers of care. To students here today, your careers are beginning in an era of great possibility. Be curious, be courageous, and above all, be compassionate. Earning the trust of your patients is your greatest responsibility and your greatest reward at the same time. When I take a look back at this award, I don't see it as a finish line, but as a milestone in the continuing journey. Our profession has given me purpose, has given me community, countless opportunities to serve, and my hope is to keep paying that forward to students, to patients, and the field of pharmacy itself. Thank you for this honor, and thank you for allowing me to be part of a profession that truly makes a difference every single day. I'm going to take questions, but I don't know what to talk.